I learned about Dr. Lemieux from another specialist, a periodontist that I go to, and I knew that my teeth were not fitting correctly, and so the periodontist referred me to Dr. Lemieux.
Can you describe?
When I came to Dr. Lemieux, he sat, looked me in the eye, took a lot of time listening to my problems, never acted like he knew everything. He waited until I could say what I wanted to say, and I could tell that he had a confidence about him in treating bites, and I felt very confident by the time he was through examining my teeth and telling me what he saw coordinated with what I was feeling, and so I felt very confident to come to him to have him work on this bite. That I had teeth that were starting to be mobile, and even some of them starting to crack, or fillings that were starting to crack, and I could tell that all the teeth that were moving and were mobile and that were getting cracks were teeth that when I closed together I hit high on. So I was just wondering if he could do something to help that bite, to help those teeth not to be mobile, cracked, and sensitive. The first thing that Dr. Lemieux recommended was to have a night guard made and wear that first to help ease the tension in my muscles from my teeth not meeting together correctly. That was a huge thing. When I wore the night guard that he made me, after the first morning I woke up from wearing it, I could tell a difference in how my jaw, I didn't know exactly what was happening, but I could tell it was changing. So I wore that night guard for I think 3 months so that those muscles could learn to relax and position themselves where they were supposed to. Then I came in and he did the adjusting on the bite, which just simply means they have some real super ways of checking with marking paper, having you bite, 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 and he could see where the bite was fitting high, and they would just adjust those bite with a little drill, make a little change here, a little change there. Spent quite a while, about an hour doing that, and then I waited 3 weeks so he could see whether that felt like it was all correct. I think he fully expected to have to make some more changes, maybe 3 weeks. I know maybe he said it sometimes takes 3 appointments, but that first appointment pretty much did it. When I came back the second time, my teeth felt great. He did a few minor adjustments, but they felt just completely different. I told Dr. Lemieux it feels like my teeth have been unstable, that they just couldn't rest, that they couldn't sit down. And I finally felt like they could just, sounds crazy, but just fit together and just sit, and it feels great. Huge difference in my entire mouth and how it feels.